Hi, I am Revati, Assistant Professor, Department of EEE, SNS College of Technology. In this lecture series video of Biology for Engineers, today's topic is diabetes. So, diabetes is a common disease nowadays all over the world because each and every person's having a diabetic case history, and frequently it is transmitted from a DNA. It is transmitted to generation to generation. So, the diabetic is a chronic disease that occurs either when the pancreas does not produce enough insulin, or when the body cannot effectively use the insulin it produces. Insulin is a hormone that regulates glucose. So, diabetes is mainly caused due to lack of insulin. So, whenever the body's glucose level increases, the secretion level increases, the insulin level of secretion is below decreased gradually. That causes the diabetes. Whenever the pancreatic is non-functioning, or else which is not produces enough insulin that required for our body, which may lead to a diabetics. So diabetes is not only the lagging of insulin disease, but it also leads to various health issues. Like it will affect one by one. Diabetes will affect kidney. So the patient with untreated diabetes, which will leads to a kidney failure. And then diabetes is also leads to heart attack, whereas the pancreas is not works properly. Whenever in the liver there is lag of it tries to recreate a lot of insulin, so that the process of purifying blood may also lag. So insulin secretion, which leads to diabetes, includes heart attack, eyesight problems, diabetic foot, peripheral neuropathy, and kidney failures. So, in diabetic foot, we all heard about the person who is having a diabetic which ranges from 450 or else above 350. They will have a wound in their leg or else wherever in body. So, they can treat by cut it off by surgical method. So, patient with diabetes may concentrate more on hygiene on the foot. So, what are the causes of diabetes? Or high blood pressure is main reason for diabetes, and obesity, body weight, unhealthy cholesterol, fat deposit in our body. Medicine, intaking lot of medicine, which is not only for diabetes but also for any other health issues, like you may have asthma, or else PCOD, PCOS, or else headache, or else fever. Whenever you're taking a lot of medicine to cure or other diseases for your body, that may leads to a decreased in the insulin level secretion, so that it leads to diabetes. So unhealthy foods, eating lot of junks, sweet items, processed foods may lead to diabetes. So pancreatic diseases, which is wound or any other things, and age factor, and it's a genetic disorder. So else, if your father is having diabetes, so it is automatically transmitted to the son. So whereas how it may be controlled is a healthy lifestyle may control the diabetic activities. Stress also a major cause of diabetes. Complications of diabetes are diabetic foot infection. So already I told you about it, where a diabetic patient will have more care on their legs and foot. And permanent kidney damage, cerebral diseases, which may leads to memory loss, or else it is leads to a lot of stress. Peripheral neuropathy, so heart attack, retinopathy, and blindness, which is lead to lowering your eye vision. So types of diabetes or type 1 diabetes, type 2 diabetes, and diabetes mellitus are some of the reason. So lot of patients are having type 2 diabetes, and particular amount of peoples are having diabetes 1, and certain levels are having in diabetes mellitus. So, type 1 diabetes affects children due to deficiency in insulin. genetic variation or autoimmune response. Whereas in type 2 diabetes, it's affect adults, caused due to insulin resistance by body, obesity, inactive lifestyle, hereditary, and leading causes. In previous slide, we have seen a lot of affected persons in diabetes or type 2 diabetes. Whereas one of the reason of diabetes is intaking consuming of alcohol. So drugs content may also leads to a pancreatic in malfunction, and then it leads to diabetic in diabetics. So that only diabetic 2 is the blue color mark is diabetic 2, so that lot of adults may consume lot of drugs and then it leads to diabetic too. So genital diabetics occur during pregnancy, excessive weight gain, genetic history of diabetes. So obesity, so sugar intakes, high calorie diet, lack of physical activities may also leads to type 1 diabetes and type 2. So treatment is insulin pills, insulin injection, blood sugar monitoring, diabetic medications or some of the treatments for diabetes. There is no permanent cure for diabetes. It may be kept in control by changing your lifestyle. So natural Ayurveda herbs are consuming all amla, methi leaves, jamun, tulasi, tiribala, so aswagandha are some of the natural intakes for diabetes. So these are all the assessments for diabetes. Thank you.